right? Got shit in my teeth? Huh? Oh, okay, cool. Here we go. What up, Gram fam? And welcome to my first edition of Endometriosis, or Endonomo. I don't know. It's a working title, but I'm going to be bringing you videos of my own personal journey with this damn disease, as well as educating you in the meantime. So buckle up. Here we go. Let's dive right in. What is endometriosis? So endometriosis is when tissue like the lining of the uterus is found in other parts of the body. And just like the endometrium, aka the lining of the uterus, these cells shed their lining every month, creating inflammation and essentially scar tissue that can glue organs together. It's important to note that this tissue is not the native endometrium. It is like it. There are various theories trying to explain exactly where it comes from, but we still don't have a solid theory as to what's happening in every endometriosis case that we see. All right, we've covered the basic definition of endometriosis. Now let's talk about the various parts of the body where endometriosis is found. And we're going to concentrate on two different areas, what we're going to call pelvic endometriosis and extrapelvic endometriosis. So pelvic endometriosis is exactly what you guessed. It's endometriosis within the pelvis and around the reproductive organs. So this includes the ovaries, fallopian tube, uterus, and the abdominal wall in that area. Extrapelvic endometriosis is endometriosis found in other parts of the body, and this can include the nervous system, pulmonary system, the gastrointestinal tract, urinary tract. It can be skin, it can be the diaphragm, thoracic cage, brain, eye, sinuses. Basically, endometriosis has been found in every major organ of the body with the exception of the spleen. Now, while some of these areas are much more rare than others, like the eye and the brain and the sinuses, we are starting to see more and more cases of thoracic and diaphragmatic endometriosis. Every year, this stat goes up a little bit. And I think that's because we are starting to listen to women's pain and actually are going in for surgery to find the culprit. This is probably a good sidebar into my own personal journey with endometriosis. So last week I met with my thoracic endometriosis surgeon here in Portland, Oregon. And while we were going through my old surgery notes and photos, we found that I had not only deeply infiltrating endometriosis in my chest wall, around my intestines, and into my abdominal wall like I had known, but it was also diving in on my liver. And this was not included in the surgery notes, nor was it reported by my surgeon. So it was most likely missed, and it explains a lot of the symptoms that I'm having these days. Next, we'll have an MRI to check out my colon and my ovary, because those are also problematic areas for me right now, as well as the liver. And after that, we will be scheduling excision surgery to take the endometriosis out. I'll keep you all posted. Thanks so much for tuning in. If you have any questions or you'd like to leave some feedback, I love constructive criticism. Put it below. Peace.